everything I asked for. Good evening, everyone. ISTA Digital Media Doctors Excellence Awards 2024 Grand Event. మీ అందరికీ స్వాగతం పలుకుతుంది. The presented by Open Full House Customization, sponsored by Audi Hyderabad and PNR Mutual Funds. Specially thanks to HealthBuzz. Media partner CVR Health Channel, Digital Media partner Big TV. ఫస్ట్ ఆఫ్ ఆల్ ఇంత వర్షంలో కూడా ఇక్కడ వరకు వచ్చి ఇంతో పేషెన్స్తో కూర్చున్న మీ అందరికీ కూడా థ్యాంక్ యూ వన్స్ అగైన్. థ్యాంక్ యూ. Yes, the debate about authentic medical content in digital media. Content is king in digital media. Unfortunately, many are misusing this notion. The majority of influencers are turning into so-called doctors and are misguiding their audience with half-baked and validated knowledge about health content, which is causing confusion among the viewers. These influencers need to understand that sacrifices and meticulous work behind securing a doctor's degree. They should, securing a doctor's degree, they should also realize that life is not just about attracting viewership with flashy thumbnails, getting video shares, and increasing the watch times. So that in order to clear up these all confusions, we bring you the debate, the need of our with esteemed masters in the field of medicine, Dr. Sri Bhushan Garu, nephrologist, Dr. Ravi Shankar Garu, senior endocrinologist, and Dr. Sudhir Kumar Garu, senior neurologist. These people, please come on to the dais, sir. Welcome.
Hi, good evening, ladies and gentlemen. Apologies if there are any boys and girls there. So, who are all doctors here? Hands up. Quite a few. Okay. Who are all not doctors? Please raise their hands. Okay, quite a few. Who amongst you believe that authentic content is the need of the hour when it comes to medical content in social media? Hands up. We better do. Sudhir? Yeah,
Definitely.
Right. Okay. So, and who believe that I think people who are not medical are allowed to do medical content in social media? Hands up, please. I know there are some non-medical people you're allowed to. If you think that non-medical people are allowed to do and put content in social media pertaining to medicine? Somebody is trying to raise their hand? No? Okay, right. So I'm going to ask some questions now. And I hope Dr. Sudhir and Dr. Sri Bhushan Raju would try to not necessarily debate. We don't expect any knives, daggers, or any harm here, because the idea is not to go to hospital again for a different reason, but just to have a healthy debate. How many years did it take for you to become a doctor, Dr. Sri Bhushan Garu? I'm not speaking about your subspecialty training or any fellowships. I'm speaking about a basic MBBS degree.
Yeah, it took around 5 years approximately.
Approximately.
Joining into MBBS. By the time I reached, I joined in 16 plus, so came out around 22.
Okay, so it took good at least 5 years and 1 year of internship to become a qualified doctor. Do you ever post videos about building bridges?
Bridges, no.
No. Why not?
It's not my kind of a thing actually. We don't have to, because that's not the topic which I'm expert in that.
Expert in.
Actually, we don't really do the things in which we are not experts. And we are supposed to do the things which we are supposed to know. And we are supposed to, we are more authentic, and we are.
You don't even care, right? You never got the idea that you need to post a video about building bridges. Do you ever post videos about making bombs or anything like that?
No, never.
No. You never got that idea, right?
No, never.
Right. Then why should a person who is not medical in the first instance try to speak about medical content when he or she is not qualified? That's a very basic fundamental point here. There is a yesterday heroine who's very famous called Bhagyashree. How many of you know her?
Who is that?
Bhagyashree. How many of you watched Maine Pyar Kiya? Hands up. I did. You didn't, sir? Gokhale sir didn't. Okay. Okay, right. At least I did. I liked her as a heroine those days. She's perhaps a bit older than me these days. She posted some content about a year back in her Insta channel or Facebook saying that these are the 5 tips to avoid bloating of your tummy. Eat these foods. I was thinking, has she done gastroenterology training or something, or at least did some MBBS after giving up her career as a film actress? I checked in the internet, and to my surprise, she didn't. I was surprised that, she didn't have a degree, but she had the audacity to even think about posting some content about tips, that to 5 tips. I don't know where these 5 come from, to avoid bloating of the tummy. And there are so many likes. I try to put some authentic content in social media regularly. I'm lucky to get 40, 50. Okay. Uh, so I think either I need to get into a film career, become some kind of a so-called celebrity there, come out of it, and try to speak about health if I really need to garner some likes and people to follow me, in inverted commas. So now that I spoke my mind, I would like to ask some questions here. How many doctors here do post some medical content, either written, verbal, or in the form of video in social media? Hands up. Who don't? Hands up. I think you're doing, the ones who haven't been posting anything, they have been doing injustice in one form because they're giving a chance to non-medical people to speak out. The more quiet and silent we are, I think the more rubbish and nonsense that we would be seeing in social media. How many of you believe that type 1 diabetics can stop insulin and get away? Hands up. Type 1 diabetics being able to stop insulin. Nobody. Unfortunately, there is a guru in this country who believes firmly, and he had the audacity to post a video about 2 years back saying that he has the medicine to cure type 1 diabetes and that those people can stop insulin once and for all. Why are we allowing it in the first instance? Do we not have any regulatory bodies? Is the government blind, deaf? I don't know. But certainly one thing is for sure, there are people who did stop insulin, unfortunately, and there is no responsibility for this, there is no accountability for this when such a thing happened. Of course, from a neighboring Telugu state, we do have someone who again has the audacity to preach that he or she can reverse diabetes without medication with a keto diet. I'm sure most of you know who he is or she is. And unfortunately, people have been getting admitted to hospitals with ketonuria, ketosis, and diabetic ketoacidosis. And we all have seen a number of such cases. And to date, no action has been taken. No action whatsoever. How long are we going to continue this? Forever? I think it is important and it's pertinent that regulatory bodies take this seriously. And who is going to bell the cat? I think the onus is on us as doctors to raise our voice. And I think let's cheer High9 to stand up and have the guts to even raise this point. I think we all need to give a big round of applause because he had the guts to even actually bring up this, saying unauthentic medical content in social media ought to be removed and should not be allowed in the first instance. If it is about likes, it's about shares, it's about making money out of social media content, there are better things to do. You entertain people, dance, you can do a number of things, but definitely not mislead people in the form of unauthentic content in social media. One thing that you can't mess around is health, and unfortunately, this is the area which is being messed around. I hope everybody agrees on this, and I think we all have this onus to do our bit in the form of asking our own regulatory bodies, being our own associations, to draft resolutions and send it to the concern. Everybody agree, or is there anybody who disagrees on this? I think we strongly agree. And this should not be just a matter of speaking few words, cheering ourselves and go. But I think if cardiologists are there, I request them to take to their respective societies, draft resolutions, and send it to the Honorable Health Minister. I wish the Health Minister is here so that we could have represented and brought this up. When a particular media celebrity or hero or heroine has some videos done against her or him, they make such a loud noise. Recently, the Cine Association has drafted a resolution saying that such videos ought to be removed from social media. If they are so particular about this, why not us as doctors? Why are we not actually bringing up a resolution and not taking this seriously? I think it's high time that we do it. Everybody agree? So now I would like to ask Dr. Sri Bhushan Rajgaru, what is pseudoscience and do you think it's being promoted in a big way in social media by these so-called influencers who don't have any knowledge whatsoever about evidence-based medicine?
As far as my knowledge is concerned, the science is the only one. There's nothing like a pseudoscience. The science is the science, and that is the truth. Whatever is the pseudoscience term probably being used nowadays is actually the invented by the people who are not related to the science, are not into the science. So that is a term which is coined and probably disseminated by the people who are having their own vested interest of showing their ignorance or innocence or arrogance. So it is a mixture of these the three and many a times, and they try to spread the things in the form of the science, which is actually the pseudoscience as per your statement. But actually, we are not supposed to encourage that because we have been seeing the patients and we are practicing the science. But actually, the background of this particular thing has come in the wake of people commenting casually and routinely about politics and the films. So they started thinking that whatever the little bit they know, they can really disseminate. Similarly, they started spreading to the other aspects also, something like a cricket. So not everybody knows how to play cricket also, but they really comment on that. Then not many people are into the politics, but they can know and they can comment and they can criticize the politicians and even the prime minister or the chief minister. Similarly, in every aspect of it. And the thing is that human mentality is to gossip. So there's a basic mentality. Like previously, the woman used to go beside. I'm sorry to say the term woman. The boys also they used to gossip. That's not an issue. But they used to go adjacent to their house and they sit and they keep on commenting whether they know about it or not. They used to spread the information in a wrong way. Social media is something like a big gossip platform which has actually transformed itself into a bigger media for the people who have such a tendency. But to gossip is a human mentality. But thing is that they should know where to stop and when to stop and which topic to be discussed and which should not be. Unfortunately, science is the victim and people started exploiting that. Now I started realizing that even the film stars started talking about which drug to be used. I have seen Amitabh Bachchan talking about it. I have seen Anil Kumble discussing about it. I have seen some of the cricketers whom I don't know actually. I know very few people. Film stars also I know very people. They also started talking about it. But I don't know how the society takes up. But being medical professionals, we are always in uh, the probably the inferior level in as far as the propagating our voices or advocating our opinions in a bigger way, and nobody takes it seriously. Also, there's another reason why these people you have seen a Supreme Court has to intervene when Patanjali started advocating that they have a cure for each and everything. And when I was into these COVID times, when I was coming in the TV news and all, one of my last TV programs which I've done, and the person sitting beside me has an intention to spread the news that the eye drops can really cure COVID. And I was just telling them that, but and there was an advocate also in that. I just started telling that even as per the Constitution of India, we are supposed to spread the scientific temperament among the people, and we cannot spread which is actually not the science as the pseudoscience, whatever you said. But actually, I was alone, and all other people actually are more in favor of putting eye drops into a patient, and then he comes out of dramatically and something like that. He comes out of COVID infection symptoms in an easy way. But people wanted that kind of a thing always. It's a human mentality again to get the things done very easily without any difficulty. I think the basic human weakness of having the things very easily and having known the things without much difficulty, and you don't have to spend your brain and anything.
Sorry
Yes.
to interrupt you. Do you think it's herd mentality?
It's a herd mentality only. It goes off. Actually, it's not that it's unrelated to the educational qualities, educational status, and even because all the people who participated in the particular debate along with me were all intellectuals, so-called, the intellectuals in the society. But then I asked the person, the anchor also, you always call me only when there's a medical thing is there in that. Have you ever called me to comment about the politics? And I can really do that also. Have you ever called me to comment about the film review or something
Sorry
like
to
that,
interrupt, but
which I
you're
can do
deemed
that?
to be unfit to comment
Yeah,
about
that's what I'm
politics.
telling you. We are actually unfit to comment about the politics. We are unfit to comment about the films and all other things. Some of us can write here and there about in the social media of our own because our opinions are supposed to be given to the society. That's not a wrong thing. But only thing is that how authentic we are actually supposed to accept the unauthentic material which is being spread in the form of science, which they are not supposed to.
So now that we have discussed about a problem, what do you think is the answer for it? Can you give one, two, three, four, five remedies, be it from the the society itself, be it from the media houses, be it from the social media, or from the government?
I think, see, definitely we need awareness. So celebrities, they can raise awareness. Like we have seen people saying that,
No,
okay, I
but
suffered.
sorry to interrupt. Most of them, unfortunately, are part of the problem
Correct.
rather than the ones who spread the awareness.
Yes. So very small fraction, they say, somebody says, I suffered from depression, you should talk about it. That's, they should stop there. But, if
They
some,
should, but how are you going to make them stop?
correct. No, I think definitely regulations are required because otherwise there's no fear. They can keep on posting just for engagement and views and, monetization. And if that, and then also the funny thing is because public also believe them. And if
Of
something
course,
is
people are gullible
correct,
and they want easy answers.
right,
And of course, some of them unfortunately believe that doctors are there to
yes,
exploit, which makes it
correct,
easy for the so-called influencers to speak about pseudoscience and
yes.
promote it in the form of science.
So I think there's only one method that is to make regulations
Regulations,
and implement them.
implement them.
Yes,
Simple. I think there is a responsibility on part of social media houses as well
yes.
to do that. On that note, I think in view of time and because we all need to go back to work and really do some good work tomorrow, I think we'll take a pledge which has been drafted by High Nine. Can I request everybody to stand up, please? Thank you. It's going to be 30 seconds, I promise. So you're going to repeat as I say. The pledge is for the right health content towards the right future. I solemnly pledge
I solemnly pledge
myself
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 that I hereby
that I hereby
strive to provide
try
trying
to
to provide
provide
the authentic health content
the
authentic
authentic
health content
content
in any social or digital platform
in any
in
social
social
or digital platform
platform
for the better future of
for
for
the
the better
better future of
future of
my mother nation.
my
my
mother
mother
nation.
nation.
I also swear
I also swear
I would never forget
I'll
Never
never
forget
forget
the core values of my profession.
the
the
core
core
values
values
of
of my
my
profession.
profession.
Neither I entertain
Neither I entertain
anyone providing unauthentic content,
anyone providing an authentic content
thyself in platform, thyself,
myself and
Myself,
platform
THYSEL,
thyself.
thyself in platform, nor do I stand
Nor
not
do I
as
stand
in the support of any platform
in the
in the
support of
support
any
of any
platform
platform
that propagates
that
that
propagates
propagates
incorrect
incorrect
healthcare content.
healthcare content.
The crucial words here are incorrect health content. Thank you very much. I think it's done. That.
Thank you so much for being here, sir. Thank you for your insights. Once again, round applause to them. Thank you so much. And I would like to invite Insta Digital Media Dr. Excellence Awards 2024 grand event presented by Open Full House Customizations Managing Director Srinivas Rajugaru. Before that, please play the AV for it.